Hello everyone. So now we will be discussing the next part of high yielding fats. So coming to trigeminal neuralgia. So the first description with treatment was given by John Locke in 1677, way back. So first description of trigeminal neuralgia was way back in 1677, John Locke. Then trigeminal neuralgia is also coined as tic douloureux. Who coined this? Andre, that is Nicholas Andre. So the name of the person, you should remember this. Then John Fothergill in 1773, he published the detailed description as Fothergill's disease. So the other name which is associated with trigeminal neuralgia is called Fothergill's disease. That was in 1773. Almost 250, 300 years it is going to, 400 years it is going to become now. Okay. Bell's palsy was given by Sir Charles Bell. So that is one thing we should remember. And some other facts. Nerve injuries, the classification was given by Sunderland. Sunderland's classification, Seddon and Sunderland classification for the nerve injuries, what you should know that. Next, condylar head and condylar neck fracture. So whenever the fractures are there, in which imaging process you can see or visualize the anatomical structures. So condylar head and condylar neck fracture is best view in reverse down view. Bilateral subconjunctival ecchymosis is not associated with LeFort-3. So they will give you options, and which is not associated with LeFort-3 is bilateral subconjunctival ecchymosis. And deciduous teeth, if you want to grasp it with the root and take it out, that is called as Warwick-James elevator. All the three are very important question. Gillis temporal approach, which is between the temporalis muscle and fascia, what we know that. So Rowe's zygomatic elevator is placed between temporalis fascia and the muscle. Rowe's zygomatic elevator. So learn this name. Whenever we are doing skin grafting or harvesting, we use an instrument called as dermatome. This is used for harvesting skin graft. And dermatome plus tomnin is used to cut, and it is an instrument for cutting thin layers of skin for grafting, very thin layer, 0.3 to 0.5 mm thickness. So that is called thin graft or medium graft or thick graft. We have a classification for that. So this is the instrument what we use that. Abbey Estlander flap is used for the reconstruction of the lip. And lidocaine, Lofgren. This is the repeat what you should be knowing that. So coming to the various cylinders what we have in our OTs. Oxygen cylinder is black cylinder with white collar. So please remember, black cylinder, it should be painted in black with white collar. This is for easy identification. Nitrous oxide cylinder is a blue cylinder. Polyglycolic acid and polygalactin 910 suture materials, they are the strongest absorbable suture materials. Polyglycolic acid and polygalactin. This is poly. So poly means it is plastic. So these are the strongest of the absorbable sutures. Silk suture material, if it is retained for a long time, a suture silk, if it is retained for a long time, wherever the suture thread passes, rail track scar develops. Rail track scar. That area it becomes. Degree of diplopia, that is double vision, is accurately developed by means of Hess chart. Again, this is a repeat thing. So that means so many times it has been asked in the examinations. Now coming to swelling, when you see a big mass or a swelling over there, the soft swelling is lipoma, or lipoma has is soft in nature, the swelling. Fibroma is firm in nature. Pleomorphic adenoma is like cartilaginous hard. Osteoma is bony hard. Malignant lymphatic nodes are rocky hard. And then Hodgkin's disease is rubbery hard. So the consistency of swelling, very, very, very important. What you should know this. So coming to some eye signs now. Eye signs in toxic goiter. So goiter, where the neck problem is there, thyroid enlargement is there, and eye signs are seen over there. So whenever the eyelids are falling halfway, that is called as Von Graffi sign. Lid lack sign also you call it. It is called as Jaffrey sign, absence of wrinkling on the forehead. So in the forehead, this area, there is no wrinkling. So there is the absence of these lines, that is called as Jaffrey sign. Mobius sign or anxious look is difficulty in convergence. So difficulty in convergence is called as Mobius sign. Converging is the power is lost. Then option Lubick flag is a semilunar flap and it is used with vertical incision in your surgical endodontics. It's a repeat question. Envelope flap is used for mandibular posterior and palatal surgeries. This is also called as bayonet flap. The other name for envelope flap is bayonet flap. There is something called as black graft, where solid pieces of both cortical and cancellous bone, both the bones are kept. Cortical bone is hard bone, cancellous bone is soft bone. Both of them are there in a graft, that is called as black graft. Examples are iliac crest and the grafts taken from the ribs. The seventh rib graft is called costochondral graft. Then Jefferson's fracture, it's a comminuted fracture of the ring of the vertebrae C1. So your neck backside C1 fracture gets involved, that is called as Jefferson's fracture. Hanksman fracture is the fractures of the pedicles and laminae of C2. Hanksman fracture. Civilian fracture is mandibular fracture with no gross communications of the bone. It's a mandibular fracture but no gross communication of the bone. There is a term called telltale hematoma. So, telltale hematoma. This is seen in coronoid process fracture. Coronoid process fracture. Very important. Telltale hematoma seen in coronoid process fracture. Now in alveoloplasty and all, when we use bone file, so the motion what you should use is only pull motion. There is no push motion in bone file. Postage stamp method, very important. What is this? Method of bone removal in transalveolar extraction. So transalveolar extraction, surgical extraction, the method is called postage stamp method. Lag screw, it will do oblique fixation. And then in local anesthesia, what you see, the depolarization is for 0.3 millisecond and repolarization is for 0.7 millisecond. So these are the values what you should be knowing. Now one more question, very important. Whenever you are injecting local anesthesia, so definitely you are not injecting inside the nerve. If I say inferior alveolar nerve block, that does not mean that you are injecting inside the inferior alveolar nerve. You are injecting in the periphery of the nerve. So my question is, how much amount of the nerve, so for example, this is the nerve and you have injected your, this is your syringe, something like this, you have injected here the local anesthetic solution. So the question is, how much amount of the nerve should be under the influence of local anesthetic solution for a conduction blockage to happen? So how much nerve should be under the influence of local anesthetic solution for a conduction blockage to happen? And the answer is 8 to 10 mm. This much amount of the nerve, if it is under the influence or surrounded by local anesthetic solution, the conduction blockage will happen. Very important question, which is difficult to get in your textbooks. Please make a point of this. Moore or Weber Ferguson incision is for hemimaxillectomy. I told you how this incision passes through. Hind's incision is for post-ramal incision. Submucosal vestibuloplasty, McIntosh and Opweg, they gave this. Maxillary torus, if there is a hard bony growth, Y incision is given to remove that. Labial frenectomy, Z or VY plasty is done. So this names you should remember. For labial frenectomy, Z or VY plasty, and for maxillary torus, Y incisions are given. In the shape of Y, like this, one incision will be given. Silolithiasis is stone in the salivary gland and the appearance will be link sausage appearance. Silidinitis is inflammation of the salivary gland, leafy tree appearance will be there. And treatment of pleomorphic adenoma is superficial parodectomy. So this is a very common question, what you know that already. What do you mean by phantom bite syndrome? Phantom bite syndrome. So now you give a denture to the patient. In spite of giving a denture to the patient, patient is not comfortable. It does not have any comfort position. Your centric relation, centric occlusion, whatever he is trying, he is not getting a comfortable position. So that bite is called as phantom bite syndrome. He is not getting a comfortable position. Darrow solution, these are given for those patients whose potassium level is less. So in hypokalemic patients, you give Darrow solution. Reese view is oblique view or optic foramen view. So from the optic foramen inside, what you do is that is called as Reese view or oblique view. Mongoloid slant seen in nasoethmoidal fracture. Anti-mongoloid slant is seen in zygomatic complex fracture. Tinel sign. So whenever the nerve is regenerating, there will be a tingling sensation. So that tingling sensation is called as Tinel sign. So Tinel signs indicates nerve regeneration is happening. Then whenever there is oroantral fistula, you take the buccal advancement flap, that is called as modified Rayman or buccal advancement flap, or also known as Berger's flap. And this is used as a method of closing oroantral fistula. This is buccal flap, and when you are taking the flap from the palatal aspect, that is called as Ashley's flap. So this is the point what you should remember. So these are some of the most important names, values, dates, parameters what you should know in oral and maxillofacial surgery. So these are the questions which ones given. These are the ones which will decide whether a person is going to get a good rank or an average rank. So when the decider comes, because there is no much logic here, you have to, this person invented this or described this technique means this person has done it. So that names, values are very important. So the most critical areas where students feel difficulty, so I have clubbed together. So this, hope this will be very useful for you. So that's all in the session of high yielding fats. Thank you.